many of you don't like the idea of getting a shot? Well, you're not alone. Hi everyone, my name is Eryn Hunter, and today I'm going to demonstrate how to give a steroid injection in the knee for those people who are more sensitive about getting shots. First, I will go over the materials needed for the procedure. After that, I will go through the steps. And lastly, I will talk about aftercare and follow-up. All the materials that are needed can be found here on this table. Some of these are actual medical supplies from an orthopedic clinic, and others I've had to make for legality reasons. When the person giving the injections enters the room, the nurse already has a sterile station with gloves set up, and also the medicines that will be used. In this procedure, I'll be using lidocaine, Marcaine, and Celestone. Lidocaine is a fast-acting local anesthetic that will wear off in a couple of hours. Marcaine is a slower-acting anesthetic, but will keep the area numb for several hours. And Celestone is a commonly used steroid in these situations. The other items on the table are an alcohol swab and a betadine swab, both which are used for disinfecting, 2 syringes, a Band-Aid, and gauze soaked in alcohol. To start off the procedure, it is important to have the patient sitting in the correct position with the knee bent at 90 degrees. You'll move your thumb around until you find what feels like a small squishy triangle. That's where the needle is going to go in later. And the best way to mark this is by lightly pressing with your fingernail. Next, you'll need to disinfect that area. So open up your betadine swab and rub this all over the front of the knee. While that's drying, you can apply one glove and start preparing the syringes. With one glove, you'll pick up the syringe, and with the other hand, you'll disinfect the top of each bottle with the alcohol swab. For the lidocaine and Marcaine, you'll draw out about 3 cc's of each, using the same syringe. Once you've done that, you will unscrew the needle and place that in a sharps container. With the second syringe, you'll do the same thing, but you'll get about 2 cc's of Celestone in this syringe. Again, you'll need to dispose of the needle into the sharps container. A new needle will be needed to be placed on the first syringe for the actual injection. Now it's time for the shot. You'll get about eye level with the knee, stick the patient, and push in the numbing medication as you're pushing in the needle. When you're finished, unscrew the syringe from the needle, leaving the needle in the knee, and reach for the syringe that has Celestone. Screw that on and slowly inject the Celestone into the knee. Once there is none left in the syringe, you'll grab the gauze soaked with alcohol, put underneath the needle, and slowly pull it out. With that gauze, you'll wipe away the betadine and apply the Band-Aid. Doing the procedure this way keeps the patient from being stuck with the needle more than once. Most people prefer this method, but it's not the only way to do it. It all depends on the person administering the shot. For aftercare, most patients are encouraged to ice the knee. The steroid can take up to 2 days to kick in, and if pain comes back after a week, then we recommend they come back for a follow-up appointment. So today I showed you how to give a steroid injection in the knee. I went over the materials, walked you through the steps, and I discussed aftercare and follow-up. I hope you enjoyed this speech, and I hope you feel better about the next time you have to get a shot.